Mick, this month is Breast Cancer Awareness Month. We've been talking about it each and every Monday, and we see many groups in our community wearing pink and raising money for those fighting the terrible disease. We're talking with Dr. Katisha Vance now from the Oncology Department at Princeton Baptist Medical Center to learn more on the signs and diagnosis of breast cancer. How you doing, Doc?
Hey, good afternoon. How are you, Sheldon?
Good seeing you. Thank you for joining us. When should screening mammography begin for an average risk woman?
Yeah, Sheldon, that question has actually become much more complicated. What I will tell most patients is that this is a discussion that you need to have with your primary provider. What all of the guidelines tell us, however, is that women should start their screening at least by age 40. With some women electing to start at age 45, but definitely no later than age 50.
Yeah, are mammograms the only way to screen for breast cancer?
So actually they are not. Mammography is our gold standard testing for breast cancer. However, for some women, especially women who are at high risk, your provider may actually recommend additional screening with ultrasound. We also have MRI of the breast that can be a very sensitive way to detect breast cancer, especially in women who are young and who are at increased risk.
Yeah. What can women do to possibly lower their risk of developing breast cancer? Can they do anything?
Yeah, so Sheldon, we know that there are non-modifiable risk factors. That is the hand that you were dealt. But there are things that women can do. For example, adopting a healthy lifestyle that places an emphasis on keeping the weight in a healthy range. I usually recommend that women try to get at least 150 minutes of modest intensity exercise every week. Doing things like never smoking or stopping if you are a smoker, and then making sure that if you drink alcohol, it's something that you have a discussion with your doctor about. We actually know that there is probably no safe level of alcohol that doesn't increase the risk of breast cancer, at least slightly.
Yeah, I'm glad we've got a little time to ask this one question. What are some of the things that a woman should look for as potential signs of breast cancer?
Yeah, that's a great question. So what most women hear is that you should look for a lump or a mass in the breast. But that is not the only way that breast cancer shows up. For some women, there is no actual mass, but there may be heaviness in the breast, redness. The other thing that you should look for is any change in the nipple. So that can be a skin change, that can be a nipple discharge, or the nipple actually turning in when it used to point out.
Yeah, and when you're looking at this as we finish up the interview, are there any resources available to help women who are uninsured and need to have a screening?
Yeah, thank you for asking that. So for some women, your local county health department can help you with screening. We actually have a program at Princeton Baptist Medical Center where we are trying to help uninsured women get screening mammograms. And you can actually call one of our numbers. It is 205-783-7100, and that's 205-783-7100. And if you say links in pink, we can actually try to get you set up for a screening mammogram.
Oh, that's fantastic. Hey, good information right there, Dr. Katisha Vance. We certainly do appreciate your time. You've done a fantastic job as usual, okay?
Thank you, Sheldon. Have a great day.
All right, you take care now.